আমার নাম Dr. Vivek Agarwala and I am Senior Consultant and Director Medical Oncology and Hemat Oncology at Narayana Health Kolkata. We have an organization called Bengal Cancer Support Group, and this is an organization of the patients, for the patients and by the patients themselves. It is completely run by the cancer patients, survivors and their families and caregivers only. Every month on 7th we have a Sath Sath meeting with our cancer patients, families and caregivers so that we educate everyone on multiple topics. This month in this meeting we had Dr. Rajiv Sareen, who is heading the genetic clinic at Tata Hospital, Mumbai, at our meeting, and we talked about the role of genetic testing in prevention of cancers in families. I just want to give a few key messages based on what we discussed in the meeting. So number one, if there are multiple people in a same family with blood relations having cancers, either same cancer or different cancers, then we must suspect that the reason behind the occurrence of these cancers may be a genetic mutation that is running in the family, and this should invite a genetic testing of the patient first in order to diagnose it. The two most common genetic syndromes that cause cancers in the families are BRCA syndrome, which causes breast and ovarian cancers mainly in women, and the Lynch syndrome or HNPC syndrome, which causes colorectal cancers as well as some brain tumors, osteomas, keratoacanthomas in the patients and families. When we talk about genetic mutations, there are two types of mutations. One is somatic mutation, which is found only in the tumor cell. This kind of mutation is usually not inherited. But the mutation which is inherited from a patient to his children, or which is inherited amongst the family members, are usually germline mutation. This germline mutation is found by a blood testing or by testing the cells in the saliva, and there is usually a 50% chance of this mutation being inherited from one person to his children. When we talk about genetic testing may not be always accurate in detecting the mutation which is causing cancer. Sometimes advanced testing might be needed. Also, genetic testing helps us in suggesting some treatment for the cancers also. And if this testing detects some positive mutation, then this suggests testing of other family members also to see if they are affected by the cancer syndrome gene or not. And if it is found positive, then such screening in normal individuals can help us to plan investigation so that we can diagnose these cancers as early as possible and at the earliest stage. If you diagnose it at the earliest stage, then the cure rates are very high. Also, if by screening such normal individuals in the family a syndrome is detected, then sometimes some surgeries can be done prophylactically to reduce the chance of cancer. For example, in a person who is detected with germline BRCA1 or BRCA2 mutation, and then if bilateral mastectomy is done, then the chance of breast cancer decreases from 80% to 5%. or if prophylactic bilateral salpingo-oophorectomy is done, that is, you remove the ovaries and the fallopian tubes on both the sides, then the chance of ovarian cancer decreases from around 60% to 5%. Also, just as I told, there are certain treatments that can be done. For example, if you are detected with BRCA1 or BRCA2 gene and you are having a breast cancer or an ovarian cancer, you can treat it with a class of drugs called PARP inhibitors, which benefit you more. Similarly, if you are detected with a Lynch syndrome and a colon cancer, then you can be treated with immunotherapy drugs, which will benefit you more. Also, it is very important for families who have these mutations to come forward for educating everyone. We should not ostracize these families. In fact, other family members should be counseled and encouraged to do the genetic testing, because if later this cancer is diagnosed in them and they come to know that other family members knew about this syndrome, then they feel cheated. So recently we saw Sonali Bendre come out in the public open and talk about her genetic syndrome which caused cancer in her. We had Angelina Jolie coming out openly in the public telling about the syndrome of BRCA gene syndrome that she had. And in this way, if people come forward and tell their own stories, this will help us strengthen more, so that more and more people come out with their cancers, and cancers can be diagnosed in the families at the earlier stages, and appropriate treatment can be given appropriate